PCOS is one of the most common hormonal disorders, but most people at diagnosis are left confused and overwhelmed. I'm a reproductive endocrinologist, and I'm going to teach you 5 things that most people don't, but should know about PCOS. I'm Dr. Lora Shahine, a double board-certified OBGYN and reproductive endocrinologist helping people with PCOS for over 20 years. And there are so many things that people often don't understand about this common diagnosis. If this is the first time finding this channel, welcome. I'm so glad that you're here. Be sure and subscribe so you get my weekly videos all about reproductive health. There's 2 other ways to learn and stay in touch. Number 1, there's a link for my newsletter in the description below. You get weekly topics and updates about fertility and learning content. The second way is my weekly Brave and Curious podcast. You can listen anywhere you listen to podcasts. We have weekly episodes with interviews of experts in the field or deep dives into certain topics. But today we are talking all about a common hormonal disorder, PCOS or polycystic ovarian syndrome. 1 in 10 women will be diagnosed with PCOS in their lifetime, but we are still learning so much about this common hormonal and metabolic disorder. There are 5 things that many people who get the diagnosis of PCOS do not know, and I want to share them with you today. Number 1, a diagnosis of PCOS can be confusing. It's so frustrating, but PCOS is a collection of signs and symptoms. There's not a simple blood test that you can do or a simple symptom that you can have that will automatically give you the diagnosis of PCOS. And people can present in many different ways. The most traditional and textbook definition of PCOS is a collection of 2 out of 3 things. 1 is ovulation dysfunction or irregular menstrual cycles due to irregular ovulation. This is often due to a hormonal imbalance, and if you're not ovulating on a regular basis, your periods can be unpredictable, sometimes going months without a period or sometimes having multiple episodes of bleeding in a cycle. Unpredictable cycles or irregular ovulation is a cornerstone of PCOS, but you actually don't have to have that to get the diagnosis. That's just 1 out of these 3 things. The second thing is clinical or laboratory findings consistent with high androgens. Androgens are male hormones. Men and women, we all have male and female hormones, but in women with PCOS, they often have a higher level of androgens or male hormones like testosterone, and this can present with lab tests that show that, or clinically, they can have acne or male patterned hair growth, either extra hair centrally, like under the chin, mustache, between the breasts, between the thighs, or male pattern hair loss, like a receding hairline or loss of hair right at the crown of the head. The third thing that gives a classic definition of PCOS, but remember you only need 2 out of 3, is PCOS appearing ovaries on an ultrasound. So the ovaries are full of follicles. Follicles are really little fluid-filled structures that have an egg in them. This is why it's often called polycystic ovarian syndrome, because any fluid-filled structure in the body is called a cyst. We think of cyst as a bad word, but a follicle is just a cyst. It's a collection of fluid in your ovaries that happens to have an egg inside. So if you have lots and lots of follicles in your ovaries, then this can be a classic sign of PCOS. Sometimes they show up in a really particular pattern. They call it a pearl necklace. The follicles line up on an outer ring of the ovary. It's like, I imagine that they're like fighting to try to ovulate, and because there's ovulation dysfunction, they kind of get stuck. So it's PCOS or polycystic ovarian syndrome, PCOS appearing ovaries, high antral follicle count. And sometimes this can actually show up with a high level of a blood test called AMH or anti-Mullerian hormone. This is a hormone that's made by supportive cells in the ovaries. And the more follicles that you have, the higher your AMH. So someone with an above average AMH for their age can be a sign of these polycystic ovarian appearing ovaries on an ultrasound, and just sort of that classic triad. So remember, it's 2 out of 3 things. Number 1, irregular periods from ovulation dysfunction. Number 2, elevated levels of androgen, either clinically or in the lab. And number 3 is a high follicle count, a high AMH, or PCOS appearing ovaries on the ultrasound. Kind of this picture is PCOS. But some people present in such different ways. Sometimes people can have one or two of the presenting symptoms, but not others. Sometimes, I was taught that there was a classic appearance of a PCOS patient. Often it's a metabolic disorder, so they're having difficulty losing weight. So patients would often have a high BMI. Insulin resistance can be associated, but some people are very, very thin and have all the classic signs of PCOS, but then have been told, oh, you don't have the diagnosis because you don't look like a PCOS patient. So number one thing that I wish a lot of people knew about PCOS is it's often tricky to diagnose. And if you have a suspicion or you're curious, ask a couple of different providers and ask why they think you have the diagnosis or not, and consider getting a second opinion. Number two thing I want everyone to know about PCOS, birth control pills do not fix PCOS. Birth control pills can actually be an amazing treatment and help people feel better on PCOS. They can often be a very appropriate thing to prescribe for a patient with PCOS, but too often people are just sort of said, hey, you've got PCOS, here, take birth control pills. And that's really frustrating. People want to understand their body. They want to understand why they're not getting periods like their friends that are like clockwork. They want to understand what this means for their fertility and sort of future health. And just giving a birth control pill prescription without education and offering other options is just not the way to treat a patient. So I'm not saying birth control pills are bad, and they can be a very appropriate treatment for a lot of the symptoms that come along with PCOS. For example, if someone's having irregular and unpredictable menstrual cycles, just having regular bleeds or even space them out to having only 4 bleeds a year or something like that. You can talk to your doctor about different ways of using birth control pills. Can keep the uterine lining healthy. Sometimes people with PCOS have such irregular bleeding, so they also have really, really heavy periods and really impacts their ability to do the things that they enjoy, or just that surprise when you're like not expecting to have a heavy flow and it just becomes a mess. Or if someone doesn't have regular cycles, or later in life, unopposed estrogen, one of the long-term risk factors of PCOS is endometrial cancer. If the lining is building up in the uterus and it's not shedding completely, then you have an increased risk of those cells that are sticking around turning into abnormal cells. So birth control pills can be very wonderful and protective for the uterus and prevent endometrial cancer. Birth control pills can even out the androgen hormones so that people will no longer have acne. Their hair growth is better when they have PCOS, but they go on birth control pills. So again, birth control pills are not all bad. What I'm talking about is just understanding that it doesn't fix PCOS. It can treat the symptoms, and people can have, feel better on birth control pills or enjoy them and use them for years to help manage some of the symptoms of PCOS. But too many people don't get education. They just get thrown a prescription and they don't understand why. And that is not okay. And the birth control pills don't really take it away. So somebody can go off birth control pills later in life, ready to try to conceive, and be very frustrated because they're not ovulating regularly, and sort of say, oh, well, these birth control pills are supposed to cure my PCOS, but now I'm off them and all these symptoms are coming back. So birth control pills are not a fix, but they can be appropriate. Get the education, talk to your doctor, get your questions answered. Number 3 thing I want you to know about PCOS, not everyone with PCOS will have infertility. I cannot tell you how many of my patients were told in the same sentence as, you have PCOS, you are going to have struggles trying to get pregnant in the future. You have PCOS, you are going to be infertile. You have PCOS, you are not going to have a baby. Like, I cannot tell you how many people are told that. And listen, sometimes people do take a while to get pregnant with PCOS, especially if they're having ovulation dysfunction and it's irregular. But these things can usually be addressed in a simple fashion, and just equating PCOS with infertility is not always the case. So again, of course, yes, sometimes people with PCOS will struggle to conceive. A lot of my patients in my fertility practice do have PCOS, but not everybody who gets diagnosed with PCOS will necessarily struggle to conceive and have the family of their dreams. So don't make assumptions. Get testing, ask your questions, but just that blanket statement that PCOS equals infertility, is not true for everyone. The fourth thing I want you to know is that PCOS is not just a fertility diagnosis. So very often people only care about it or think about it, or not patients, but providers are just like, oh, well, you're not trying to get pregnant right now? Okay, well then take birth control pills because that will fix your acne, it'll help protect your uterus, all those things that we talked about. But PCOS is more than just worrying about when you're trying to have a baby or, when you are thinking about family building. PCOS is a lifelong diagnosis. It can be associated with high cholesterol, insulin resistance, increased risk of diabetes, other metabolic disorders later in life. PCOS is more than just fertility related. It is lifelong, and it takes understanding and learning and finding a provider that's actually going to watch for these things over your lifetime. Not to make you nervous, but just to educate you. Again, PCOS is more than just a fertility diagnosis. It is lifelong. It's a metabolic diagnosis. It's a hormonal issue. And learning more about this and finding a provider that's going to educate and walk with you through this process longer than just the time that you're trying to get pregnant and have a baby is going to serve you and help you have a healthy and wonderful life. And the fifth thing I want people to know about PCOS, lifestyle optimization is a wonderful treatment for PCOS, but it's not the only thing to worry about. So I think there's been such a backlash with so many people having that interaction I was talking about earlier. Like, you have PCOS, you're going to be infertile, here's a pack of birth control pills, don't come back and see me. That there's this shift away from trusting Western doctors, medically trained doctors to care for PCOS, and people are looking more towards influencers and sort of like cure your PCOS with this diet. Don't eat carbs if you have PCOS and you'll be fine. Take this supplement and your PCOS is going to go away. Now listen, I am a huge believer in lifestyle optimization for your reproductive health, for your PCOS health, for your whole life health. It's so important to think about nutrition, exercise, sleep, stress management, and supplements can be helpful. Nutrition is amazing, but just for someone to only do lifestyle optimization and not be under the care of a doctor that's also checking cholesterol levels and looking at your thyroid function and looking at your insulin resistance, all of these things can be managed and really helped by lifestyle optimization, but it might not be the only thing that you need. And I just think trying to combine testing, a true diagnosis, education, and lifestyle optimization is the way to go. I hope this was helpful. PCOS is so common, yet it is so misunderstood. And we went over 5 important topics today. Let's recap. Number 1, PCOS can be tricky to diagnose, so don't be afraid to get a second opinion. Number 2, birth control pills don't fix PCOS, but they can be an amazing treatment for a lot of the symptoms that come along with it. So get your questions answered. No assumptions. Number 3, not everyone with PCOS will struggle with infertility. Some people will, but not everyone. Number 4, PCOS is more than a fertility diagnosis. It is a whole life and health diagnosis. So you've got to learn a lot about it and find someone that's going to help you along the way. And number 5, lifestyle optimization is key for PCOS health, just like it's key for reproductive and overall health and well-being. But it might not be the only thing that you need to address all of the facets of PCOS. I hope this information was helpful and valuable for you. Like this video if you learned something, comment with questions that you have or topics you'd like me to cover in the future. Be sure and subscribe to this channel so you get my weekly videos all about reproductive health. And until next week, wishing you love, luck, and pineapples.